In the science laboratory, accidents or injury occur unexpectedly. What will you do? This is section Foxtrot. Welcome. The topic we're going to discuss is first aid in the science laboratory. First aid, according to the Cambridge Dictionary, it is the basic medical treatment that is given to someone as soon as possible after they have been hurt in an accident. If in case of an accident or injury, what is the best thing to do? Inform the teacher to apply first aid. We will discuss incidents like burn, eye irritation, and minor cuts. Heating one's substances is part of the laboratory science experiment. Once a hot liquid is accidentally poured to any part of your body, this is what you're going to do. First, call the attention of your teacher. Go to the wash station. Cool the affected area with running water about 5 minutes. Note, do not use very cold water or ice cube. Perfume and substances that goes in your eye can cause a problem. This is what you're going to do. First, call the attention of your teacher. Go to the wash station. Clear the irritation by rinsing it with eye wash. Note, avoid rubbing in your eyes. It can spread or worsen the contamination.
Minor cuts.
Call the attention of your teacher. Go to the wash station. Wash the cut with mild soap and clean water. Take some hydrogen peroxide and dab it to the affected area. Apply antibiotic ointment on the cut. Why do we need to apply hydrogen peroxide? This is to disinfect the affected area. Why antibiotic ointment? To prevent infection. Lab safety. Eating and drinking in the lab. Do not eat food, drink beverages, or chew gum in the laboratory. Do not use laboratory glassware as container for food or beverages. Proper lab attire. Dress properly during a laboratory activity. Long hair, dangling jewelry, and loose or baggy clothing are hazards in the laboratory. Long hair must be tied back, and dangling jewelry and baggy clothing must be secured. Shoes must completely cover the foot. No sandals allowed on the lab days. A lab coat or smock should be worn during laboratory experiments. Walk. When going to the lab, make sure to walk. There will be no running in the lab. There will be materials and equipment out that can break if you accidentally knock into them. There may be electrical wires on the ground that you may trip over as well. Please walk and be careful. Handling chemicals. All chemicals in the laboratory are to be considered dangerous. Avoid handling chemicals with finger. Always allow use a tweezer when making an observation. Keep at least 1 foot away from the specimen. Do not taste or smell any chemicals. Check the label on all chemicals bottle twice before removing any of the contents. Take only as much chemical as you need. Never turn unused chemicals to the original container. Never remove chemicals or other materials from the laboratory area. Handling equipment. If you do not understand how to use a piece of equipment, ask the teacher for help. Hand washing. Keep hands away from face, eyes, mouth, and body while using chemical or lab equipment. Wash your hand with soap and water after performing all experiments. Cleaning up. Dispose of all chemical waste properly. Never mix chemical in sink drains. Sinks are to be used only for water. Check with your teacher for disposal of chemicals and solutions. Fire safety. Labs, especially for those using solvents in any quantity, have a very high potential for flash, fire, explosion, rapid spread of fire, and high toxicity of products of combustion. Heat, smoke, and flame. The lab fire safety program provides fire safety and fire regulatory information specific to laboratories. Broken glass. Do not immerse hot glassware in the cold water. The glassware may shatter. Examine glassware before each use. Never use cheap, cracked, or dirty glassware. Never handle broken glass with your bare hand. Use a brush and dustpan to clean up broken glass. Place broken glass in the designated glass disposal container.
Accident and first aid in laboratory. Common accident in laboratory are corrosive poisoning and non-corrosive poisoning. In corrosive poisoning, if acid is swallowed, do not make the patient vomit. Dilute the acid by giving milk of magnesia. If alkali is swallowed, first, make the patient drink water, swallowed by lemon juice. Non-corrosive poisoning. Make the patient vomit. A tablespoonful of common salt or mustard oil should be given to a patient to encourage him or her in vomiting.